my name's Karen and I'm one of the Skills and Development Advisors at Inspira. And with me today is...
Hi, I'm Liz Hunter. I am a physiotherapist.
Thank you very much for joining us today, Liz. So we're going to talk a little bit about your career in physiotherapy, but first off, what other kind of jobs have you had in your career?
Well, I first qualified in '88 and started working as a physiotherapist in the NHS. So I worked there for quite a few years until I'd had both my children. And then after that, I started working in the private sector. So just a little bit different, same role, but just a little different way of working. And latterly, I did a PGCE, so then I worked as a lecturer for a while. And I've also set up my own business, so now I'm a private practice owner as well as still working as a physiotherapist.
That's brilliant. So what are the routes into physiotherapy as a career?
The traditional route still is via A-levels. Most people going into physiotherapy will have 3 A-levels. I think the UCAS, I had to look this up, UCAS points is about 128, but each university has its own entry requirements, so it's best to look for students to look up on the university individual sites. You can also go in with BTEC, especially people with other experience, other life experience, or having done other jobs. Often if they apply at a later date, sometimes there's a little bit of give and take on qualifications. These days, this wasn't so when I qualified, but you can now train to be an associate physiotherapist, so like a physiotherapy assistant. And for that, you just need BTECs. And there's some other healthcare type qualifications that you can enter through. Now, my professional body is called the Chartered Society of Physiotherapy. On their website, there's lots of information, but there is a new development that is not ready to go yet, but they are hoping to start running degree level apprenticeships. Wow. So physios will be able to work in a physiotherapy department within a hospital, but also have 2 days a week in college.
That's fantastic.
So there's quite a few different routes.
That would be a really exciting development, absolutely. So I think most people would assume physiotherapy to do with treating people with sports injuries. But can you tell us a little bit more about other ways in which you can support your patients?
Okay, well, all physiotherapists have to have quite a large toolbox, because when you go through your training and when you're first qualified, you'll be working in the NHS and you rotate around different departments. So you might work with respiratory care, which we've all seen physiotherapists on the television during the COVID crisis. So lots of physios work with respiratory care, and so you might be working in a big team of doctors and nurses in intensive care units. There's also neurological physiotherapy, so I might sometimes in my practice, but also in hospitals, treat people with a whole range of different conditions following, say, having had a stroke, or if a patient had Parkinson's disease. You also work a little bit with children sometimes, so you might be, or you can actually specialise and become a paediatric physiotherapist. There's also the medical wards or the surgical wards. So when people have been into hospital with and had operations, sometimes the physiotherapists will work on there. And then there are some slightly more specialised routes you can take with physiotherapy. So like some specialist hospitals might have a burns unit or a spinal injuries unit. You might work with elderly care in care homes. So there's quite a big variety of different roles. So it's best for people to realise that it's not just all about sport. There's a lot of other things that come under the umbrella of physio.
It's quite a wide topic, really. That's really, really interesting.
Yeah, especially for the first couple of years of qualification. After that, then you can start to choose to become more specialised, and your role will, you'll go down one of those routes.
Brilliant, thank you. Now, you mentioned that you work for the NHS, and you've also mentioned that you now run your own business. So what advice would you give to anybody who's thinking of starting up their own business?
Yeah, I mean, it sort of evolved for me. I think I did it because my children were quite young and my family aren't here. So working in private practice for somebody else initially, and then I decided to work for myself, and it was just myself initially. So then I had other therapists come and join me. Then I needed a receptionist, and now I've got different types of therapists work for me. So it sort of evolved over time. So I can't say I'm a business person. I'm definitely a physiotherapist. But obviously running your own business has different pressures. When you work in the NHS, you're amongst a big team, and you know your conditions and hours and everything of work is very set. So lots of decisions about your profession are taken by your managers. When you work for yourself, you have more choice in how you work and how you practice. Having said that, in both places, whether you're in the NHS or social care or in your own business, we all have to follow our professional guidelines. So your professionalism doesn't change, it's just the way you work. So I've got a lot more flexibility than I would have if I worked in the NHS. Yeah, I mean, I like working for myself. It's a challenge, it's quite hard. You're responsible for other people. But you know, it's like having your own little empire that you can build and decide which direction you take it in. So it's maybe allows for a little bit more creativity, a lot more responsibility, but also flexibility. So you know, I like it, but I can see it wouldn't be for everybody.
You've mentioned quite a few sort of pros and cons there to working for yourself. What would you say, if you had to, was the best part about being your own boss, and maybe the worst part?
The best part is having that autonomy to choose how I work. You know, I don't have anybody tell me that I can only see patients once every half an hour. If I want to spend 2 hours with a patient, I can. So I think that freedom to work as I choose to work, I really like that. That's probably the best part about it. The worst part is probably like now during the COVID, it's a big financial worry. So, you know, it's a lot more responsibility, and sometimes that can feel a bit daunting, especially when you've got staff that you're responsible for. So, you know, you're responsible for the way they work. You're responsible for maintaining their income. So yeah, I think there's a lot more responsibility and pressure with running your own business.
But that goes with having the extra reward and the flexibility as well that you were saying are the real sort of perks of things. Brilliant. Our last question for you now, Liz. What advice would you give to our young people who are thinking of considering a career in physiotherapy?
Okay, well, I think visit the Chartered Society Physiotherapy website, because it will give you lots of information about the different roles of physiotherapy. Talk to some physios that you know, or get in contact with a physio and try and speak to them. Most years I have a student. So they're normally A-level students. I find that's the best age group. And they will come once a week and spend a few hours with me, and we'll talk about the role, and they'll watch me work, and then I often get them to do a case study to get them to think like a physio. So I think if you can get some work experience, for one, it will help you make the decision, but also it looks really good on your application. It's a very competitive course to get onto. So if you've done some previous work experience, either in the NHS, in a care home, or, you know, places like the Calvert Trust, you know, outdoor centres where they look after children, I think that would stand you in good stead as well. I think it's a really lovely profession. It's flexible. You get to work with lots of different types of people. It's a professional role, so it's always evolving. You're always having to learn. So it's not something you're going to start and then do the same thing. Research means that the job is always progressing and changing, so you need to keep up to date. You have to always go on courses every year to maintain your registration. So I think it's, if you like to learn and you like to be active, then it's great. If you like to be with people, and especially communication skills are very important.
That's great. Thank you so much for your time, Liz. We really appreciate you giving us this information. Thank you very much.